we're recording, we're live now, and really wanted to give our members an opportunity to talk about how they would best spend those dollars and really what the difference it would make for the populations that they serve. So a quick overview. So once again, welcome to Advocates for Ohio's Future webinar. My name is Kelsey Bergfeld. I'm the director of our coalition, and we are a group of over 500 individuals, organizations, policy folks, researchers, providers are really united to make sure that our most vulnerable populations have what they need to live healthy and successful lives in vibrant communities. So what we are discussing today, Ohio was assigned from the American Rescue Plan Act over $5 billion. So this $5 billion pot is just for state initiatives. We know that there are a ton of different funding streams, lots of different kind of buckets and pockets of funding from the American Rescue Plan Act. However, we are simply talking about the State Fiscal Recovery Fund at the state level today. So that is our main focus, talking about different projects and proposals for that fund. So Ohio so far has received the first half of that $5 billion allocation, and then we will see for the second half in May of next year. A couple ways that the state and the federal government has decided the state can spend these dollars. Again, really focused on recovery from the coronavirus pandemic and resulting economic crisis as well, recovering, repaying, especially our essential workers who stepped up for us and provided really, really important services during the time, rebuilding some of our infrastructure across the country, and then of course restoring some services that we saw either minimized or cut altogether on the government level. So as we stand today, right now there is about $850 million of that first allocation of the initial $5 billion left in the State Fiscal Recovery Fund. So we have heard from the administration, from Governor DeWine, that his priorities so far are investing in our state park infrastructure as well as behavioral health infrastructure. Both important topics, but I think some of our members as well have some ideas of where those dollars can be best spent. So these allocations, these different funding proposals have been going through either the state controlling board process or through the General Assembly through legislation. We saw a bill at the end of the state budget process at the end of June. Earlier this year, House Bill 168 sent a big chunk of these dollars, over 2/3 of this first allocation, including almost $1.5 billion to repay the state unemployment debt, or what they borrowed from the federal government over the last 18 months. We saw $250 million go to the Department of Development for, again, water and sewer infrastructure projects, and then $84 million go to the Department of Mental Health and Addiction Services for pediatric behavioral health facilities. So these are the proposals, the investments that the state has made so far from this big pot of money at the state. However, there has been little to no opportunity for public input on how these dollars have gone out. The administration, the General Assembly, has introduced a bill or added an amendment into a bill that was already passed in one chamber and sent over, kind of without any really opportunity for public discussion, public hearing, or a really kind of long-term invested and involved public planning process. We know that Ohio needs to have a robust state recovery plan, and we've seen many of our partners on the local government level engage in a process to allow constituents, to allow residents to talk about their priorities, talk about the changes that they'd like to see in their communities, and really take that information, take those suggestions, come up with a plan, and then even garner feedback from those same residents in terms of planning on how those local allocations will be spent in their communities, that they can see in their neighborhoods and really see the differences. So we anticipate, we've heard from some friends of the administration and others, kind of a Capitol bill-like process where some of these proposals are submitted not quite publicly, but to different General Assembly members, to the administration, about where these dollars should go and what they can be used for. We will hope to see them in a bill soon, but again, we want to continue to prioritize the need for a robust public input process. So we would anticipate by the end of this fall to see some kind of bill for the allocation, at least for the remainder of the first allocation. That was $850 million left in our first allocation of the state pot, and then even possibly dipping into that second half coming to the state in May. So with that being said, we are excited to gather many AOF members and friends here today to talk about different priorities that we would like to see in the health and human services sector, across sectors for different purposes, how much money it would take, what difference it would make, and the impact it would have across different populations in Ohio. So without further ado, I would like to introduce Lisa Handler-Fugit from the Ohio Association of Food Banks. Lisa, when you're ready, please take it away.
Thank you, and good morning. And I'd like to begin by thanking Kelsey and Sarah and Advocates for Ohio's Future for convening this presentation today to provide a forum for our nonprofit and frontline providers to present a brief overview of our needs and priorities that we are asking Governor DeWine and the Ohio General Assembly to consider when making their decisions on allocating this one-time COVID relief funding through the American Rescue Plan. Each year, the Ohio Association of Food Banks and our 12-member food banks and 3,600 nonprofit and faith-based member charities serve millions of Ohioans who face hunger. They live in every town, city, county in Ohio. They are our neighbors, classmates, co-workers, families, and friends. COVID-19 pandemic brought hunger in America to the forefront of the public consciousness. Every food bank nationwide reported a record number of people turning to them for help, many for the first time ever. The pandemic revealed just how quickly low-income and economically vulnerable Ohioans and their families can collapse into economic hardship and food insecurity. Ohio food banks have and continue to serve as ground zero as COVID responders for these Ohioans. Every day since March of 2020, we have worked tirelessly serving millions of Ohioans who have been impacted by a killer pandemic that brought record job losses, massive unemployment, education and critical access disruptions, and economic chaos. Governor DeWine recognized the crisis and heard our pleas for assistance in the early weeks of the pandemic, as businesses, schools, and commerce screeched to a halt and as Ohioans sheltered in place. I want to thank the governor for his leadership, and more so the deployment of 500 National Guard soldiers who served at our food banks in the largest statewide hunger relief mission ever. These citizen soldiers, airmen, provided us with not only their equipment and assets, but they served hand in hand, side by side with our food banks as we responded to the record number of Ohioans who turned to us as their only lifeline for food and other basic needs when their cupboards and their bank accounts were empty. We will be forever eternally grateful to these soldiers for their 16-month deployment that ended in early July of this year. Unfortunately, the demand for food and a sustained response has not ended for numerous reasons that I will share with you and are the basis for this one-time request for food and urgent infrastructure needs. Next slide, please. The association is seeking a one-time investment of $25 million for the purchase of food and personal care items and $5 million capacity building to our member charities. Our 12 food banks are collectively requesting one-time support of $153,865,000. This support will be used to rebuild and address many of the various needs that we have, including but not limited to the recruitment and retaining of essential staff urgently needed to replace the National Guard soldiers and the volunteers who have not returned to help our food banks and member agencies. Funding will be used to build and operate new hub market models to replace the agencies that have permanently closed in some of the highest poverty areas of our state. Funding will be used to purchase, build, and renovate new warehouses in additions and to receive and distribute more food. support additional transportation infrastructure, including the purchase of semi-tractor trailers, box trucks, and vans to increase our statewide delivery capacity, warehouse racking, replacement of forklift equipment, and additional storage for dry goods and purchases and upgrades for replacing and aging refrigeration and freezer units, and support an expansion of construction for new commercial kitchens. We need to start and expand additional workforce training and reentry programs and provide for additional food and personal care, household cleaning purchases, and additional support for more localized wraparound and direct services to assist our families and clients in need. Next slide, please. Why is this investment needed? The pandemic has revealed how broken and brittle our food supply chains are, leading to skyrocketing food costs, shortages, and long delays. As an example, a semi-tractor trailer load of peanut butter, a staple source of protein, prior to the pandemic cost $35,000. Today, it costs $49,000, representing a 40% increase if you can find a manufacturer who can supply it within a 60 to 90-day delivery schedule. Food banks and member agencies are struggling to recruit more volunteers now that the National Guard mission has ended. Currently, we are not able to recruit the number of volunteers that we had pre-pandemic, as volunteers continue to be cautious for their safety and the safety of their community members. Other corporate volunteers are not returning as workers continue to work at home. The workload and demand on our food banks remain high, leading to the increased need for more staff and for food banks to begin direct service operations in communities across the state that have lost their local pantries due to permanent closures. Next slide, please. Food banks are now the de facto grocery store for many families and communities, providing take-home groceries and other food for nearly 1 million people per month. Over 850,000 household members now receive take-home groceries each month from our network in state fiscal year 2021, and 130,000 people are receiving hot meals, backpacks, and senior box programs. Next slide, please. Justification of this request. This one-time request for support will help our statewide network respond to the negative economic impacts of COVID-19 pandemic now, tomorrow, and into the future. We'll expand our reach into communities we serve, providing direct relief through food distribution, direct home and agency deliveries, meal preparation, food prescriptions, and child and senior nutrition programs, as well as mobile markets and other programs. It will allow us to provide premium pay and bonuses to our essential frontline warehouse staff and hire new additional staff to keep up with the demand. The investment of ARPA funds to make significant one-time investments in our network, which provide nearly 1 million people every month with food, and to prepare again for future economic crisis, natural disasters, and to better serve our clients, reaching low-income hungry Ohioans where they live, work, play, pray, and learn. Next slide. This investment will directly impact communities hardest hit by the pandemic, especially low-income families, seniors, and communities of color struggling to regain their economic footing. We'll provide support to food banks and partner agencies in our collective efforts to build the capacity and improve services in all 88 counties of the state. It will be used to reduce hunger and food insecurity and the negative health outcomes of chronic disease. This request of $183,865,000 represents an investment of just $63.40 per person served in federal fiscal year 2021. It is a sound, wise, and targeted investment that will ensure our state can provide the most basic of all human needs for our citizens, the food they need to live an active, healthy life and be productive. Thank you for the opportunity, and I would be pleased to answer any questions that you may have at the end of this presentation. At this time, I'd like to turn it over to Kelly at the Children's Defense Fund. Kelly?
Thanks, Lisa. Hi, everyone. My name is Kelly Visral. I am the Senior Health Policy Associate for the Children's Defense Fund Ohio, And I'm going to be joined in this presentation by Nikki Reese, the Senior Strategist for Advocacy and Communication Solutions, and my colleague at the Children's Defense Fund, Catherine Unger, who is a Policy Associate. CDF, Children's Defense Fund, is an organization built out of the Civil Rights Movement, and CDF Ohio has been working on behalf of children in Ohio and their right to grow up happy, healthy, and thriving for 40 years. Next slide, please. We know that children don't come in pieces, and we want to request that these dollars be focused on a whole child well-being. And two ways we believe this can be done is by using those ARPA dollars to expand school-based health centers and make investments in the Child Tax Credit Navigator Network. Next slide, please. I'm going to be speaking, Nikki and I will be speaking about the school-based healthcare. We know the need for school-based healthcare is clear and urgent. We know that students' physical and mental health are critical not only to their academic success, but success far into the child's life. The school-based healthcare would offer equitable access to physical and mental health services through the community-connected school-based healthcare. It would reduce barriers to educational attainment and employment later in life, help narrow health inequities, and increase access to quality healthcare for the whole community. Next slide, please. And at this point, I will turn it over to Nikki to talk to you about the proposal.
Thanks, Kelly. So this proposal grew out of a number of conversations that began in late 2020 around how to grow and sustain our school-based healthcare infrastructure in the state. The proposal would appropriate $25 million per year over 2 years to increase access, whether through new school-based health sites or deepening those that already exist. It would become a statewide program jointly administered through the Departments of Health, Education, and Medicaid. And our recommendation is that any application process would prioritize schools that serve children of color or children at higher risk of poor outcomes, which covers both rural and urban areas. Next slide, please. We included in our language, and this proposal, I should say, also came about as the result of conversations with about 15 to 20 different organizations, many of whom signed on to the original request to the governor's office back in late spring. We propose that it should be a joint submission by both a education district, a school district, and a community nonprofit partner, because we wanted to make sure that both sides were equally represented in the effort. We did create a list of examples of how the money could be spent, emphasizing that this is infrastructure and capacity building, and making sure to note that these are not intended to be long-term dollars, that these programs would have to prove themselves to be sustainable after a 2-year investment. So the idea here being that we've had an extreme effect on children and their education, both health, mental, physical, and their education academic outcomes. We know providing school-based healthcare helps to alleviate some of those and would go a long way towards hopefully mitigating some of those effects that we will see. Next slide, please. So we know there's a long-term impact. Here are some of the notes you've seen. I think we can go to the next slide. And again, just more emphasis on, well, this is the slide for the next couple of pieces that I know we're going to talk about here in just a second. But I wanted to also give a little background as to where this particular proposal sits within the sort of gray area of the conversations with the governor's office. So the proposal was submitted to the governor's office in late spring. We've had a number of conversations with the governor's office, with Medicaid, with health, and with education. We know this proposal has some interest from the governor's office. And in fact, in conversations with the Department of Education, we know that they are also thinking deeply about how this can be implemented. So we believe that there is a great chance of success for funding of some level on this particular proposal. We also know that the more support and weight that can be given to such a proposal from organizations such as the Children's Budget Coalition, which submitted this proposal, or AOF, gives even greater weight to the opportunity that we have before us to make this investment. Some examples of the things that we would want to see these dollars serve would be capital costs to build new health care sites, technology infrastructure to support ongoing telehealth, personnel to build and grow to a sustainable size. So that would include potentially school nurses, social workers, embedded social workers or counselors. We also could see a district and a nonprofit partner using these funds to build a mobile unit and that could then go around and serve several different sites. We know communication and community outreach is so important when it comes to having parents and families and caregivers and students trust school-based health centers. So there could be dollars spent in order to communicate and do community outreach and have some investment that way. And then also staff training. We know that for a school-based healthcare site to end up being effective and have what it needs, it can truly cost anywhere as low as sort of $10,000 just for the basic needs, all the way up to a mobile unit that could be upwards of $400,000. So we wanted to create a number here that would allow for, in our view, somewhere around 30 projects to really invest deeply and be able to succeed long term. Of course, that would be up to the administration, how they eventually funded that. We said if they want to give us more money, we can happily do more projects. But we know there are at least 30 school districts and nonprofit partners out there who would be willing to jump on this immediately to bring more school-based healthcare to folks. So we believe that using the federal ARPA dollars in this way meets the requirements, that it both mitigates some of the pandemic problems and concerns for our youngest learners and for our youngest citizens, but also gives us a long-term stable foundation that will enable us to hopefully provide future benefits for students as well. With that, I will cede the rest of the balance of our time over to talk about the CTC Navigator Network.
Nikki, very quickly, we did have a question in the Q&A asking if the proposal will address the needs of children with disabilities.
Yes, in the sense that we know many school districts are already serving students who have disabilities. And in fact, many of them have, for example, school nurses who are with them all day long. I think we would like to see proposals that come in from districts and from nonprofit partners that take that into account and certainly provide ideally either the structural supports, because we know not every school building is fitted out for those who are differently abled, as well as perhaps more personnel to be able to deal with the increased needs.
Great, thank you so much, Nikki. Catherine, you're up.
Yeah.
Thanks, Nikki. So I'm just going to switch gears still and ask on behalf of Children's Defense Fund of Ohio. And as Nikki mentioned, also these two asks are also from the Ohio Children's Budget Coalition. But we see a need for a child tax credit navigator network in the state of Ohio. So as we know, raising children is expensive and many families struggle with the cost of childcare, housing, clothing, food, you name it. And according to a strong body of research, the path to ending child poverty is by providing child-focused financial support to families. And for those of you who don't know, the American Rescue Plan Act expanded the child tax credit to provide an increased advanced credit, fully refundable to more families. And so what this means is there's $3,600 available for children 0 to 5, which is coming in $300 monthly advance payments from July to December, with the second half coming if you file your 2021 taxes, and then $3,000 for a child from 6 to 17, $250 in monthly advance payments from July to December. And this is great for Ohio families, but unfortunately, we know there are a significant amount of children in the state who aren't automatically receiving these child tax credit payments because their family maybe didn't file taxes in 2019, 2020, or never filed to get their stimulus payments. And there's an estimate that there's around 116,000 children who are at risk of missing out on the child tax credit because of not receiving these funds automatically. And this unfortunately means that the lowest income children are the ones who are most likely missing out. So those who stand to benefit the most are those at risk of missing out on this dollar amount. Next slide, please. Thank you. We know the child tax credit is already helping Ohio families for those who are receiving this money. There's been 1.6 billion distributed to over 2.1 million children in Ohio with an average payment above the national average of $437 per family. And a new report from my colleague, who's also on the line, Will Petrick from Policy Matters Ohio, analyzed just how the child tax credit is impacting Ohio families by looking at the household pulse survey before and after July 15th when the payments started. And so just really briefly, if you look at the basic household expenses, prior to receipt of child tax credit payments, there was an estimated 1.15 million adults with children who reported difficulty paying for their basic household needs in the last week. But after the child tax credit payments began, there was a decrease of about 26%. So that's a pretty significant amount. And there was also a decrease when families were asked about food insecurity, or sometimes or often not having enough to eat in the last week, with a decline of 36% after child tax credit payments began. Next slide, Kelsey. Thanks. And so our proposal is, $10 million of ARPA state fiscal funds to establish a navigator network across the state to assist families with accessing their child tax credit payment that they're owed. As I mentioned before, there's an estimated over 100,000 children in Ohio who aren't automatically receiving this money. And so a $10 million investment to support this many children results in a possible return on investment of nearly $350 million for Ohio's children and also Ohio's economy, because we know families are spending the money on food, on school supplies, on clothing, on this basic household needs, on rent, supporting Ohio's economy. And also helping caregivers sign up for the child tax credit is an eligible use of state and local fiscal relief funds under the ARPA guidance, which I've linked here in the Treasury FAQ. So with that, we strongly urge that the state set aside some money to hire and train navigators to help our families enroll in the child tax credit. It is really a win-win for families, for children, and the local economy. So with that, I'll hand it back to you, Kelsey. Thank you.
Excellent, Catherine. I think we have a question for Catherine, for Kelly, for Nikki, if you have a moment with us. What help, if any, will be directed to children who have lost one or both parents through COVID-19 through these proposals, or of anything that you know about within this space? That may be a thinker.
That
Kelly?
I believe that is a thinker, but
Right.
that's a great question. And someone else has an answer. I would have to go back and look into that.
Yeah, there are some parameters when it comes to the child tax credit of, being a caregiver for over the 6 months. So it really would depend on those certain criteria there, but I think there would be a way for that money, hopefully, to follow the caregiver of that child from the child tax credit, which we know is a significant amount. And with multiple children, that $3,000 adds up and can be utilized, but I can get back to you on that.
Excellent. That's wonderful, Catherine. Thank you so much. And thank you all for your presentation. Next up, we have Susan Jagers from the Ohio Poverty Law Center. Whenever you're ready, Susan.
Thank you. Good morning. Thank you, Kelsey and Sarah and Advocates for Ohio's Future, for the opportunity to talk about some of our priorities for the American Rescue Plan dollars. The Ohio Poverty Law Center draws on the day-to-day experience of our legal aid partners in their work to serve clients and improve communities. We're drawing on that experience to recommend investments from the state recovery funds that lift up families and communities most harmed by the pandemic and to address disparities in healthcare. Next slide, please, Kelsey. Just to reiterate and reinforce what Kelsey said in the opening of this webinar, the American Rescue Plan gives us an opportunity to begin undoing longstanding racial and economic inequities that the pandemic exposed and worsened. How our elected officials choose to spend the funds and what complementary policies they put in place for the long term will make a crucial difference in limiting the pandemic-induced hardships and build a more equitable recovery. This is a historic opportunity to invest in people and communities and infrastructure. And we do call on a robust and transparent public process for determining the best use of these funds for an equitable recovery for all Ohioans. Next slide, please, Kelsey. I'm going to probably be a little more general than my previous partners in their presentations, but I do want to highlight some areas that we think deserve attention as part of Ohio's recovery plan. As part of the planning process that we would love to see, Ohio should consider the best ways to address inequities, improve access to behavioral health care services, increase child capacity and access for Ohioans returning to work, address Ohio's affordable housing crisis, and although it's not a bullet on my slide, as important is expanding broadband infrastructure and affordability. All of these areas are areas that need planning and coordination of other funding to ensure that Ohio is making the best use of all the available local, state, and federal dollars. So these are allowable uses of the state recovery fiscal funds, but there are also other funding streams that can be used, and a planning process to address these issues is important. And Ohio has a jump start on the plan to address inequities. Early in the pandemic, it was clear that the toll of COVID was exacerbated by years of disparities in access to care. As a result, Governor DeWine appointed the Minority Health Strike Force to assess the disparate impact of COVID-19 and make recommendations. The strike force issued a report with actionable recommendations to both eliminate racial and ethnic disparities in COVID-19 and other health outcomes and improve overall well-being for communities of color in Ohio. Ohio's leaders should examine where the state recovery funds can best be used to make progress on the report's recommendations. So there's already a jump start on the plan to address those inequities. Next slide, please, Kelsey. So just to get a little more specific with our recommendations, we support and propose some more specific investments of the State Fiscal Recovery Funds, including the outreach for the child tax credit. We support the $10 million ask for the Child Tax Credit Navigator Program, Child Tax Credit Navigator Program that you just heard Children's Defense Fund talk about. So I won't go into that any more than to say that we know the child tax credit is already making a difference, and we support that ask to invest in the outreach to support that credit. Next, we want to talk about reducing lead exposure, which is another allowable use of the American Rescue Plan dollars. Lead poisoning is costing our state billions in poor health and lost productivity. We know that kids spent more time at home during the pandemic, potentially increasing their exposure to lead. A recently released report from JAMA Pediatrics found that Ohio had the second highest rate of children with elevated blood levels in the nation. So we support the Ohio Lead-Free Kids Coalition request that $500 million in state recovery funds be dedicated to residential lead abatement and lead hazard control across the state over the next 2 fiscal years. This funding would provide much needed investment in the lead workforce necessary to conduct home repair and maintenance, lead hazard control and lead assessments and certifications to ensure residential units built before 1978 are lead safe. An infusion of resources into lead remediation work would help to build pathways for jobs throughout the state, including communities most impacted by lead, creating safe and healthy housing for not only children today, but for future generations. I want to talk a little bit about support for local emergency rental assistance programs as well. Between the Consolidated Appropriations Act and the American Rescue Plan, Ohio will receive about $1.4 billion for emergency rental and utility assistance. This dedicated funding from the Consolidated Appropriations Act went either directly to cities and counties with larger populations or was subgranted by the state to community action agencies serving smaller jurisdictions. The distribution of this much needed assistance for eligible renters and property owners has been a challenge for many local agencies. They are overwhelmed with applications and staffing shortages. These barriers could put the dollars at risk while the need for assistance remains high across the state. Because all of the emergency rental dollars to date went directly or indirectly to communities, the state does not have dedicated resources to provide support to local communities and community action agencies. The American Rescue Plan rental assistance dollars have yet to be granted, and the state has an opportunity to use them in a way that responds to the lessons learned from the past year. Ohio should dedicate either state fiscal recovery funds or a portion of the ARPA emergency rental assistance dollars towards a state level support system for housing stabilization and a streamlined process across jurisdictions. This could help communities respond to questions, process applications, and ensure dollars are getting in the hands who are at risk of eviction. Because the American Rescue Plan emergency rental assistance dollars can be spent through 2024, a small investment in state level support can ensure the local agencies meet their community needs and spend all of their eviction prevention housing stabilization funds. And finally, I just want to talk about local civil legal services. As a result of the coronavirus health emergency's disruption of the economy, funding for Ohio's civil legal aid programs plummeted and remains far below 2019 levels. Funding for legal aid programs is derived from interest on lawyers' trust accounts and monies collected through civil court filing fee surcharges. As a result of the public health emergency, interest rates were dropped to 0%, and as courts closed and Ohioans curtailed their legal activity, we saw a decrease in civil filings. While funding is slowly increasing, it's still far below pre-pandemic levels. And this drop in funding coincided with a soaring need for civil legal action or civil legal services among vulnerable Ohioans. Legal aids have been seeing an increased demand for eviction prevention work and help with housing issues, unemployment compensation work, education issues as children return to classrooms, domestic violence, and based on history and experience, we will likely see more need for foreclosure work and debt and credit issues. Ohio State Recovery Funds can be used to support critical civil legal services needed to mitigate the long-term consequences of the pandemic on low-income and vulnerable Ohioans hit hardest by the pandemic and help ensure a strong, equitable recovery. Appreciate the opportunity to present these suggestions for the American Rescue Plan dollars, and I will turn it over to Gina Wilt from Ohio. Thank you.
Thank you. Thanks, Susan. So my name is Gina Wilt, and I'm the Advocacy Director for the Coalition on Homelessness and Housing in Ohio. It's an honor to be here and an honor to be a part of the Ohio team who's been working night and day for decades on ending homelessness. So to be here at this point in time with these resources within grasp, it is an incredible opportunity. And I love how Kelsey and the Advocates for Ohio's Future brought this together and clearly defined why we are here, to recover, to restore, and to rebuild. So making sure every Ohioan has a safe place to call home is intersectional to every issue that has already been raised and that will be raised on this call today. Ohio has had a serious and growing affordable housing shortage for years. Even before the pandemic, there were only 42 rental units that were affordable for every 100 extremely low income households. And nearly 400,000 Ohio households spent over half their income on rent. And with rents increasing 14% since January, that's nearly 4 times faster than usual. So the situation has gotten worse. And despite current federal efforts, Ohio has housing needs beyond the short-term emergency relief measures. So again, the pandemic has highlighted that this need has been pent up and the time to connect into this opportunity is now. And so we are asking for, and actually I shouldn't say we, it's not just Ohio. This ask that I'm about to share was actually signed by over 180 organizations. It's a diverse group of social service agencies who are on the ground working hard every day, combined with serious business groups that see the global economic impact housing has on the work that they do. So we're all in this together. We all understand there is no ego in the coronavirus. And I can send around that joint letter because we're certainly grateful for all the partners who are helping us progress this agenda. So we're proposing to invest $391 million in capital initiatives developed in tune with the state's guidance that the funds be used for one-time investments that bolster existing infrastructure. So I'm going to tick down through the list. So starting with $150 million in gap financing through Ohio's housing tax credit programs to develop around 1,000 units of permanent supportive housing to serve survivors of human trafficking, domestic violence, chronically homeless individuals, individuals suffering from severe and persistent mental health issues, behavioral health challenges, et cetera. The next item would be $150 million in gap financing to leverage 4% tax credits and multifamily bond programs to develop and preserve up to 5,000, hopefully up to 5,000 rental units that are that would be made affordable to lower income Ohioans. We're also suggesting $45 million over 3 years to update homes for low-income homeowners through the CHIP program, expanding home repair, accessibility modifications through the Housing Assistance Grant Program, all about keeping seniors and Ohioans with disabilities in their homes. We're asking for $15 million to fund one-time capital projects that increase housing opportunities for our homeless youth. $12 million to expand the FUSE initiative to house, help make sure our justice-involved Ohioans have access to housing. And then $6.75 million to expand the Healthy Beginnings at Home pilot for families at risk of infant mortality. And I actually want to touch on this a little bit more because this one's near and dear to my heart. We know that, and we've heard this on the call earlier, we know that integrated health and housing interventions that address racial disparities, housing insecurity, homelessness, all are key factors correlated with adverse birth outcomes associated with the high rate of infant mortality. So a few years ago, OFA allocated about $1 million to fund a pilot program to really test the science and the impact of providing housing opportunities for pregnant women. And Celebrate One came together with Homeless Families Foundation, CareSource, Columbus Metropolitan Housing Authority. There were several other partners too. They all came together to do this pilot, and they provided like a comprehensive approach to women in housing. So housing, rental assistance, medical care, all the important social services that they needed while they were pregnant and then after their baby was born. And Healthy Beginnings at Home actually looked at the science. It had demonstrated promising findings. And so we know that the women who had the housing assistance had way better birth outcomes than those that did not receive that assistance. So we want to replicate this great collaborative effort to help more women, to help more babies get to the point where we can really show the statistically significant data, improve our case to the powers that be at the federal level so that we can progress more permanent initiatives to help pregnant women. So that one's very important as well. This whole list is important. So to continue down the list, other investments would include creation of a state administered landlord risk mitigation fund to attract landlords. We need more landlords. We want to attract landlords to help rent to individuals who might have challenges and whatever we need to do to get landlords in the mix. So that all individuals, regardless of their eviction history or whatever type of challenges or histories that they have, that we have a landlord to match them up with. So we would like to work on that. We'd also like to work on housing supports for people with developmental disabilities, which could include any type of smart home investments or updates to equip their home with whatever various technology that would be needed for self-sufficiency, for safety, whatever it takes. So I could keep going, but I'll stop there and just say we are focused on creating affordable housing options to improve people's quality of life And because we know it will create jobs, it'll reduce state spending, not to mention local spending on other publicly funded systems, whether you're talking about hospitals, courts, jails, prisons, homeless shelters, foster care, etc. So there is definitely a collective benefit for prioritizing affordable housing development, for focusing on affordable and accessible housing development. Home repair, neighborhood revitalization, and community development is all critical, which is why I'm so excited to introduce Emily Lungard, who will speak next. We are united in our ask for affordable housing and community development. I do not believe that it's a either or. I feel like it's an and both. We need to move on all fronts, and strengthening our neighborhoods go hand in hand with affordable housing and with genuine relief and recovery. And maybe it sounds like we're asking for a lot. I don't know. I don't think so. But we might not get this chance back. And I know this has been said, but this really truly is an unprecedented opportunity to utilize unprecedented federal resources. And a robust Ohio Housing Trust Fund, for instance, strategically coupled with a strong one-time ARPA investment, will certainly lead to ending homelessness. It'll lead to significant strides in ending homelessness. We can actually be bold. We have the time to be bold right now. We have the money to be bold, and we have the time to take more surgical steps that we really maybe haven't been able to take before. So I'm looking forward to working together to enact permanent solutions, and I'll turn it over to Emily.
Thanks, Gina. Good morning, advocates for Ohio's future, and thanks for facilitating this really important conversation. Can't tell you how much I appreciate the opportunity to be here to elevate some additional housing and community development priorities for American Rescue Plan funding. I'm Emily Lungard, Senior Program Director for State and Local Policy at Enterprise Community Partners. If you don't know us, Enterprise is a national nonprofit that exists to make a good home possible for millions of families without one. Home is where life happens. It's where plans are made and futures begin. It's the foundation for dignity, health, education, wealth, and community. Yet rents keep going up, paychecks do not keep pace, and good homes in strong neighborhoods are increasingly out of reach. The system doesn't work, and it's got to be changed, and it's got to be changed by us, frankly. The American Rescue Plan offers such a rare opportunity to do just that. Enterprise is a proud member of the Housing and Community Coalition that Gina just referenced a moment ago. This is really a new and unprecedented collaboration of leaders in housing development, homelessness services, community and economic development that all came together during this really once in a generation opportunity to say, let's all link arms and collectively advocate for what we believe to be some modest, yet potentially transformational requests for Ohio's hardest hit communities and most vulnerable families. In addition to Enterprise, I'll list some of our members here because I really do think it's a pretty extraordinary coalition that we've pulled together. So of course we have the Coalition on Homelessness and Housing in Ohio. Thanks, Gina, and thanks for the shout out. The Affordable Housing Alliance of Central Ohio, Corporation for Appalachian Development, Economic and Community Development Institute, the Finance Fund, Greater Ohio Policy Center, Habitat for Humanity Ohio, Heritage Ohio, National Church Residencies, NeighborWorks Collaborative Ohio, the Ohio Capital Corporation for Housing, and the Ohio CDC Association. It's a real mouthful, but I had to share that list because, again, this is a really phenomenal coalition that's come together around two asks that we think are really important and, like I said, can be transformational. The first is a one-time $100 million allocation to the Ohio Housing Trust Fund. And what that appropriation would do is enable local nonprofits across Ohio, so we're talking rural, urban, and suburban communities, to maintain and repair homes, to increase development and preservation of affordable housing, and to prevent and end homelessness. So housing security, and we're talking access, stability, affordability, it's hard to come by, and frankly, it's only becoming harder. For instance, in Cleveland alone, where I'm sitting today, the most recent census data shows that 26% of our homeowners are housing insecure. And that number jumps to 51% for renters. So the bottom line is Ohioans are forced to make some real toxic trade-offs between a roof over their head and medicine, food, healthcare, etc. The Ohio Housing Trust Fund is the state's primary and most significant resource. It's been doing that for about 25 years in Ohio, and it's a really smart investment. Every trust fund dollar leverages an additional $3.19 and generates $8 in economic opportunity for the state. So if we can invest $100 million of the American Rescue Plan into the trust fund, we'll expand safe, decent, affordable housing for low-income seniors, transition age youth, infants at risk, Ohioans struggling to overcome mental illness, addiction, and homelessness, and more. I'm just naming a few here. The second ask that our coalition has is a one-time $100 million allocation for existing and new community and economic development programs. These programs will empower Ohio's families through housing, job creation, financial stability, and food security. It'll fortify Ohio's small businesses and main streets. It'll ensure recovery is equitable. So as we think about recovery from the pandemic, we need to think about Ohio's main streets, historic downtowns, neighborhoods, businesses, employees, because these are the foundational building blocks for true revitalization. So we're talking about people and place-based investment. Some of these programs, I'll list them out here, are Healthy Foods for Ohio, the Historic Preservation Tax Credit, the Ohio Main Streets Grant, the Ohio Microbusiness Development Program, the Ohio Transformation Fund, the Ohio Main Streets Job Recovery Program, the Ohio Financial Empowerment Fund, and last but certainly not least, targeted neighborhood home ownership development. So I know that's a laundry list here, but I just got to say, if nothing else, COVID-19 has really highlighted the foundational importance of home and community. With all the investments I've listed, and again, that's $100 million to the Ohio Housing Trust Fund and $100 million to rebuild Ohio's communities, we can really address that impact that COVID-19's had on our homes and communities. But more importantly, we can blaze a new path forward that creates a state with some resiliency and some stability and frankly, some empowerment. So on behalf of Enterprise Community Partners and the entire Housing and Community Coalition, I wanted to thank you again for this opportunity. And I shared a lot today, so if you'd like to learn more, check out our website. Our coalition is serious. We created a website. It's www.ohioandcommunitycoalition.org. I really hope you give it a look, and I'll share it in the chat today. So thanks again.
Excellent. Thank you so much for your presentation today. Lots of great ideas of how we can put these dollars to use. And then presenters, quick heads up. So we had a little bit of a mix up in our PowerPoint, and our next slides are actually solely from the council. Alex, we've got you up next, if you don't mind. So you are up next.
Thanks, Kelsey.
Keep you on your toes. Thank you.
All right, so as Kelsey mentioned, I am Soli Hernandez. I'm with the Ohio Council of Behavioral Health and Family Services Providers, and I am going to cover our behavioral health priorities for the State American Rescue Plan funds. And I also took the approach of more of a general request instead of a specific proposal, because there are unfortunately just so many areas where we do need enhanced funding. And so I think the next slide, just shows you a little bit about the Ohio Council. So we are a trade association. We represent mental health and substance use disorder treatment providers, and we have over 150 members across the state of Ohio. So next slide, please. Thank you. So we actually have had discussions with our member organizations recently in May and June to identify their recommendations for the needs of funding for clients and their communities. And so that's what our proposal is based off of, the recommendations of our members based on what they're seeing in their agencies and in their local communities. And so I have a list I'm going to talk quickly through, but these are the identified areas from those discussions. So workforce recruitment and retention, crisis services expansion, access to housing and housing supports, mental health peer services. I think the next slide has just a couple more. Yep, so reinvestment in the full range of substance use disorder treatment, technology, infrastructure, and capital investments, expanding jail and correctional services, and then school-based services. And so I'll get a little more into all of these in the next slides. So for workforce recruitment and retention, to the degree that these funds can be used, our recommendation is to prioritize them to support the workforce development and sustaining the existing behavioral health workforce. So behavioral health has experienced a significant workforce shortage. I know, every area seems to have a workforce shortage, but this is something the behavioral health sector has been dealing with far prior to the pandemic, and the pandemic just exacerbated these issues. And so when we talk about workforce recruitment and retention, some of the ideas that have been shared that have been beneficial in organizations providing behavioral health treatment is support for clinical supervision, loan forgiveness, tuition reimbursement, recruitment and retention bonuses. And then really the issue that's come up recently is that not only do we have a current shortage, but we have an issue where we don't have enough new people coming into the field. And so really looking at funding to support community awareness efforts to entice people into the field and elevate the value of careers in behavioral health. And with crisis services, there are a number of organizations providing crisis services, but funding is limited. And so any funds that can be used to expand access to necessary crisis services, they could be used to support the development of implementing mobile crisis response, where a social worker can go out on scene to someone who's having a behavioral health crisis, and looking at that for youth, children, adults across the full age span. And then also crisis stabilization services. So that idea of kind of like a behavioral health urgent care, behavioral health emergency room. Unfortunately, currently, most people in a behavioral health crisis have to go to the emergency room. There's not a specific crisis stabilization center for them in most areas of the state. And then additionally, looking at supporting what is referred to as a firehouse model for funding. So right now, the way crisis services are funded is a fee for service model, meaning you only can bill for services if you're face-to-face with someone, but then, that becomes difficult to support staffing, to have staff on standby, similar to a fire station, right? So whether there's a fire or not, the firemen are there, and the same needs to be true for behavioral health workers to respond to crises in the community. Access to housing and housing support. So I know we've already touched on housing a little bit. So this would be specific to housing that would support people with behavioral health needs and their housing stability. And so really looking at funding the full continuum of supportive housing options for families and people with severe and persistent mental illness, including people in recovery from addictions and those transition-aged youth that are experiencing mental, emotional, and behavioral issues. So there are a number of models of supportive housing that have been very beneficial for people, but they need and require funding to implement. In addition to supportive housing models, really the funding could be used to provide resources for rent and utility subsidies for people in need, and also looking at helping fund residential treatment facilities and recovery housing providers for just ongoing maintenance and repairs of their facilities. Mental health peer services. So really for behavioral health providers, there are not a lot of financial options to support organizations in providing mental health peer services. And this has been a valuable service that's really been highly regarded as effective in treating people with mental health conditions. And so These funds could be used to help providers invest in this programming specific to mental health peers for people in need of services, their family members, parents, and then also youth peer services. And additionally, not just funding organizations, but then also looking at funding and building capacity for consumer operated programs, clubhouses, and other models for social connection with peers. And when we talk about reinvesting in the full range of substance use disorder services, so I don't think it would be a surprise to anybody to say that we have a significant opioid problem in Ohio, and that has not gone away. And we recognize that. Unfortunately, the pandemic increased opioid issues, but also increased the use of alcohol. And we've also seen a significant rise in the use of stimulants, which is causing concern. And there is significant funding for opioid treatment, which is great, but there is not as much specific funding for some of the other substance use disorders. And so it is important to really make sure that we have adequate funding to treat any type of substance use need, because the opioid funding is specific to opioid use disorders. And so we would recommend designating funds specifically for prevention, treatment, and recovery supports for alcohol use disorders and co-occurring alcohol use and stimulant misuse or abuse. And then in addition to, prevention, treatment, recovery, these funds could also be used for harm reduction strategies across all substance use disorders, although typically you're seeing those harm reduction strategies with opiate use. So that would look like needle exchange programs, that would look like getting fentanyl testing strips out to the community, those types of strategies. Technology, infrastructure, and capital investment. So behavioral health providers are often nonprofit organizations, and they do have limited funding options, limited revenue based on their payer sources. And so that also means they have limited capital funds for infrastructure upgrades and capital investments. And their funds could be used to support health information exchange implementation and ongoing costs so that their electronic health records can talk with hospital and other medical providers' records, telehealth equipment and software for staff and clients, equipment just to provide those services. So laptops, tablets, cell phones, Wi-Fi, broadband access, software and VPN upgrades to support more remote work. And then capital investments would look like, facilities, buildings, vehicles, other equipment. Expanding jail and correctional services. So again, this is a theme. Funding for these types of services is limited, and we could use funding to support medication-assisted treatment in local and state correctional settings and more providers being sent into jails and prisons or other institutional settings to provide treatment and engagement services so that they can assist with any kinds of transition needs or issues and engagement and treatment for people once they are released. And then school-based services really have been very successful, but the pandemic has certainly seen a rise in demand. So the funds could be used for prevention, consultation, treatment, and school staff development. And then in addition to these priorities, we strongly encourage all funds to be directly distributed to providers as often as possible, because this really reduces administrative barriers and costs and supports a quick implementation of services regardless of the county of someone's residence. And so with all that said, all of these are necessary. I don't want to say, we would just pick one, but if we would just pick one, workforce is the most important, because if we don't have workforce to provide the services, we could build the best system and allow, as many services as possible, but we need the people to provide the treatment. And so given that, that was pretty much it. So given that these are one-time funds, we really would look at, workforce investment, workforce strategy, and that is kind of the end. So if you have any questions for me, you can put them in the chat or send me an email, and I'm happy to connect offline with folks as well. Thanks, Kelsey.
Excellent. Soli, thank you so much for your time today. Again, there's no shortage of needs out there. I'd next like to welcome Alexandra Weingarth from the Ohio Council for Home Care and Hospice. Hello, good morning.
Hello, good morning. Thank you so much, Kelsey, and thank you to AOF for allowing us to present today. I'm really excited to talk about home and community-based services. So first, I want to do a brief introduction of the Ohio Council for Home Care and Hospice. We are a nonprofit trade association that represents over 600 home care, hospice, and palliative care agencies all across the state of Ohio. Our agencies provide a wide range of services to individuals in their homes and communities. Those services look a little bit different. They can provide DODD services, aging services, veteran services on a skilled intermittent basis, or they can do that for more long-term care within the home setting. Next slide, please. I wanted to talk a little bit before we get into our direct ask for the ARPA plan and just let you know that there is a specific allotment allowed for home and community-based services. So Section 9817 of the ARPA plan gave states enhanced federal funding that can be invested to enhance, expand, or strengthen home and community-based services. This includes behavioral health, Medicaid waivers, those with intellectual or other developmental disabilities, and those that are elderly or otherwise disabled, and other similar community services, which includes the families, children, and adults. The Department of Medicaid did put out a plan that basically states that they want to invest within 8 different categories. And those 8 categories is for immediate support for providers, improvements in informational technology and program infrastructure, reimbursement and expansion of services, strengthening the workforce for home and community-based services, using telehealth and technology supports for individuals within the community, diversity, equity, inclusion initiatives for addressing social determinants of health, care management and quality improvement, and also supports for individuals receiving services and informal caregivers. So what I wanted to talk to you about today is OCHCH's proposal for that funding plan. Next slide, please. So what we have suggested is a methodology which would include a 2 lump sum payment to providers. We want this to explicitly be used for recruitment, retention, and training of both personal care aides and nursing staff, both for home health agencies and home care agencies. So what we have seen during the COVID-19 pandemic is a healthcare workforce shortage. But what is unique to home care situations in general is that we are basically competing with institutional based care. So we've heard a lot of agencies losing workers to facilities down the road that have the ability to give enhanced sign-on bonuses, can pay nurses $5 more within wage and so on and so forth. Or, you know, a home health aide can make $1 more to an agency or an institutional based setting down the road. So we see that workforce kind of moving around, and that is definitely our #1 priority right now. So we know that this enhanced FMAP is available on a limited time basis. So we hope that Ohio will continue to invest and focus on the most immediate need for home and community-based services, which is workforce. Next slide, please. The dollar amount. So Ohio is actually allocating, and you can go to the next slide, $517 million specific to the home and community-based services program. Next slide. And why is this investment needed? So this investment is important because during the COVID-19 pandemic, we saw increased costs to home care and home health agencies. So PPE was rising. Of course, it was difficult to get a hold of, but it was also very expensive. Other costs were incurred as well by agencies. And as you can see, we did a survey of our membership to take the temperature of what was happening. And we saw a reduction in monthly revenues of 27% and gross margins saw a reduction of 25%. So at the same time, there's been increase in wages. This is a very difficult industry to go into. You are providing personalized care within somebody's home-based setting. The wages did increase by, we saw an average of 13%. So while the costs have gone up for staffing and other related expenses, our revenue has gone down. So this is an untenable situation that home health agencies and home care agencies are now experiencing within the field. So again, we hope that this timeframe of the EFMAP will look at the dollars going specifically into workforce related programs and priorities. Next slide, please. So within home and community-based services, our agencies, again, provide that wide range of services. A lot of them are Medicare certified home health agencies, but they do provide Medicaid and aging services within the state of Ohio. Reimbursement rates are significantly low in the state of Ohio for those types of services. Our agencies want the capability to keep people within their homes, and they have the ability to keep people within their homes and provide services. Home and community-based services has expanded, and they used to be the eyes and ears in the home, but now they're able to provide the similar, if not the same services as you can receive in an institutional-based setting. And it is a very cost-effective form of healthcare. So right now we are seeing that agencies are struggling to hire staff because of the reimbursement rates. It is having an impact on the staff that we are able to hire. We do want to recognize and thank the DeWine administration and within the legislature for recognizing the need for investment in home and community-based services. We are supposed to receive a 6.1 increase to the home and community-based services reimbursement rates. So for that, we are very thankful. But we hope that these ARPA dollars specifically can be given to providers in these two lump sums to be directly for our workforce. For providers to invest in, to recruit, retain, and of course, hazard pay, bonus pay for all of the most very important work that our agencies and their caregivers have been providing during the COVID-19 pandemic. Next slide, please. How does it fit in these state spending guidelines? Next slide. So this proposal does not replace existing Medicaid investments in home and community-based services. So with these lump sum payments that are going to be earmarked, it will not replace the existing funding or supplant the funding for current initiatives or priorities. These lump sum payments would ensure that spending is viewed as an additional investment. And we hope that's not confused with supplanting, again, that existing funding. And earmarking these dollars would ensure that these dollars are used to invest for the future of home and community-based services programs. As we said previous, the Department of Medicaid does want to invest in long-term services and supports with this money and the future of home and community-based services. So with reporting requirements, we believe that the lump sum payments would make it easier for Ohio to report these requirements to CMS and simpler to manage. So within these two lump sum payments, we see a gap of at least 6 months. This proposal is one-time in nature, and we can see that this is financially sustainable beyond March 2024, which is one of the requirements that CMS did state with the, ties to home and community-based services enhanced MAP funding. So we hope that Ohio, again, considers sustaining these investments beyond. And if Congress does provide an EF MAP permanently, we would hope to seek this investment going towards workforce development and potentially earmark that rate for increases of lump sum payments within the future. The long-term impact. Next slide, please. So we know that workforce is so essential for home and community-based services. They are the ones that are the eyes and ears within the home and help individuals find their independence and remain where they want to be with their families. Without providers to serve these patients and without the workforce, there's no service or care that can be provided to our communities. This is the most immediate and pressing problem within home and community-based services. There are no lack of referrals for home and community-based services, but there are a lack of workforce that want to go into home and community-based services. And we hope that the state will invest within these programs. Our agencies want to be able to serve all individuals that want to receive their services within their home. And they will not staff a case that they cannot fully staff all of the hours of services within the home environment. So we hope by making these funds available to providers and the lump sum payments, this investment can make immediate positive impact within our communities. And that's all I have. I'm happy to answer any questions that you guys have.
Alex, thank you so much. Very quickly, we did have a question. I'm asking if the lump sum payments would include independent providers in your proposal.
So we have not explicitly hashed out all the details within the lump sum payments. This was, as the Ohio Council for Home Care and Hospice, we represent providers, of agency providers specifically. So that's what we had in mind when we did detail that plan. But again, no specific details of what type of agency or what type of provider should or should not get that money.
Excellent. Alex, thank you so much for your presentation. Up next, we have Rebecca Kuzner from the Ohio Workforce Coalition. Rebecca, you're on.
Thank you. Good morning, everyone, and thank you for the opportunity to talk a bit about the Ohio Workforce Coalition's recommendations for the ARPA funding. It is particularly exciting for me to be speaking after our last two presenters who are really advocating for workforce investments, because usually I'm the only person really pushing those. So I am excited to talk more to each of you. So the Ohio Workforce Coalition is interested in these allocations, particularly in partnership or as a way to support our partners. So I will not have specific dollar amounts, but want to talk you through what we think is critical as these dollars are rolled out, particularly as we think about people getting back to work and how they can support themselves and their families. Next slide, please. So I'll let you read about who we are and what we do. Our current focus and our priorities are on job seekers, employers, and workforce systems. And I want to be clear that many people think of the OMJ centers when they're thinking workforce development, but the workforce initiatives come through TANF and SNAP employment and training and college and career centers, state-funded initiatives like Tech Cred and sector partnerships, and then, as you just heard from the two previous speakers, a range of other stakeholders. Next slide. The coalition does prioritize improvements and investments in job seekers, employers, and Ohio's workforce system. We also recognize that right now there are fundamental changes happening to employment relationships and the nature of work. For the first time in decades, workers are gaining more power. People are voluntarily leaving their jobs at rates that match historical highs. And an analysis of millions of job listings a day found that a share of postings that say no experience is necessary is up over two-thirds over 2019, while the share of employers or postings offering starting bonuses has more than doubled. COVID-19 has created an opportunity to renegotiate how Ohio's job seekers and workers are supported, how Ohio employers recruit, train, and treat their workers, and how Ohio's leaders decide to navigate a new economy. Next slide. To be clear, while I think and talk a lot about work, the coalition does recognize that food support, quality childcare, accessible transportation, and health needs must be addressed for Ohioans to be able to show up for work. While ARPA does not include or does include specific requests for workforce plans of infrastructure projects, the most direct and significant workforce funding is going to be found through the federal budget reconciliation and other competitive federal grant announcements that will be coming down. So therefore, the coalition is prioritizing requests for ARPA support that are coming from AOF's partners as they advance the basic needs of all Ohioans. We are interested in how these funds are deployed, as that will have an impact on these services, as well as an ongoing impact on workforce development across the state. Next slide. The coalition's priorities for job seekers, employers, and systems will ensure that ARPA support leads to an equitable economic recovery. Ohio's essential workers in the areas we've discussed today have to receive hazard pay which can be retroactive, will allow these workers to stabilize their families, develop skills, and continue to grow in the workforce. It's particularly important to make sure that this pay can be made accessible for gig workers and other people piecing together multiple low-wage jobs and caring for all of us through the pandemic. Since the beginning of the pandemic, the number of employers having difficulty attracting and retaining talent has increased from 30 to 49% for blue collar companies. The competition for workers is high, and it's during a time when workers are looking for more than wage increases. So while wages are starting to trend up, it is also time to make sure that we are prioritizing investments for employers that are in turn investing in their workers and creating quality workplaces, while also holding employers accountable for improvements to racial equity, job safety, and overall wage and hour issues. And then finally, the deployment of ARPA funds is happening in part with influence from Ohio's workforce systems. One state level contact of the coalition recently indicated that the funding discussions are still underway, and workforce will be a significant part of the allocation, but nothing can be shared yet. Therefore, it's really unclear to us who's making the recommendations, how they're being vetted, what the goals and impact will be. And without that direct input from stakeholders, we run the risk of spending funds without really understanding whether we're advancing the interests of all Ohio workers or employers, missing out on innovations in the workforce development field that can accelerate access to jobs, and then responsibly spending these once in a lifetime investments. So in the spirit of this webinar, transparency, we would like to see transparency become more a part of the ARPA discussion, and we look forward to collaborating with our other AOF partners to make sure that these investments are spent in the best way possible. Thank you.
Rebecca, thank you so much. We really, really appreciate your time today. And for our presentations, last but never, ever least, I would like to welcome Will Petrick from Policy Matters Ohio. Take it away, Will.
Thanks, Kelsey. And big thanks to Advocates for Ohio's Future for organizing this. And thanks for everyone for taking time out of your day and who's still with us. Again, my name is Will Petrick. I'm the budget researcher with Policy Matters Ohio. We're a nonprofit research institute. Our mission is to create a more vibrant, equitable, sustainable, and inclusive Ohio through research, strategic communication, coalition building, and advocacy. And I got involved in this work because I believe that all people, regardless of what we look like or where we live, deserve to thrive and deserve to live with basic human dignity. And so, like the last three speakers, I'm planning to talk more about how we can support essential workers, particularly workers with low wages, as we prioritize resources for the recovery in Ohio. But I'm also going to provide a little bit more context. So my colleague, Mike Shields, a lot of this is from his State of Working Ohio report, but you can go to the next slide, Kelsey. So we know that COVID and the pandemic did not affect people equally. Wealthy people held on to their wealth or made even more, and people who were already barely making ends meet on low pay really bore the brunt of the crisis. And many of these folks are still struggling to get by. So this slide highlights how 1 million people were laid off when Governor DeWine issued the stay-at-home order. And in June of this year, 2021, 269,000 Ohioans, more Ohioans were still out of work than before the pandemic. And so we think it's important to measure the economy by people. Too often analysts measure the economy by corporate profits and stock prices, but people are the real drivers of our economy. So the next slide highlights a little bit about what's happening with folks in Ohio right now. So this is based on the Household Pulse Survey. This is very recent data. So it's based on survey results between August 18th and September 13th of this year. So roughly 2.2 million adults had difficulty paying for their basic household expenses in Ohio. 9% of adults reported that they didn't have enough to eat in the last week. And 16% of Ohio renters reported that they were behind on rent. Next slide, please. We also think it's really important to highlight that there were huge inequities before the pandemic, and the pandemic has exacerbated those inequities. So this slide highlights how for years, Black workers have been paid less than white workers. So last year in 2020, white people were paid on average $21 an hour. That's $5 an hour more than Black people in the state of Ohio, who were paid $16 an hour. We also know from research that Black and brown folks were more likely to work in those frontline industries and also get sick. You can go to the next slide. This highlights that Black Ohioans were also more likely to get let go during COVID. So Black Ohioans had more than double the unemployment rate of white Ohioans in 2020, 15% compared to 6.8%. And again, Ohioans of color hold more than their share of essential jobs. So Black men are 20% more likely to be in essential jobs than white men, and Black women are 55% more likely than white women. And again, we know these disparities between Black and white Ohioans aren't new. It's important to note that this is a result of decades and centuries, really, of choices, policy choices that excluded Black Ohioans from building wealth and financial security, from education and housing opportunities. And so it's important that certain lawmakers at the state and national level for a long time have shifted resources away from Black and brown communities, away from poor and working class Ohioans, and toward the wealthy and well-connected. And we believe now is the time to shift that priority. This next slide highlights that COVID also had a major impact on gender inequities. So women were pushed out of the workforce at higher rates than men. And again, women are also more likely to work in low-paying essential jobs. So in recent years, women were making progress in terms of joining workforce participation and also the wage gap. But COVID really pushed thousands of women out of the workforce. We know, some of this is due to a lack of affordable childcare options, but we also know that women, again, were concentrated in the jobs that were destroyed by the pandemic. So I share this context because, again, it highlights why in the recovery, we really need to prioritize the folks who have been most impacted, people of color, women, and workers with low wages. So, we believe that no matter our race, no matter our gender or where we come from, most of us work hard for our families. But again, for years, certain politicians and the corporate interests that back them have blamed folks who are paid low wages. They blame Black and brown communities and new immigrants for our hard times. This is a strategy to distract and keep us divided and to hold down working people's wages. On the other hand, over the past year, we have seen that when we all come together, we can rebuild power, and we can, improve working people's lives and protect people's well-being. So, we know that the federal government stepped in and the state government to care for working people in an unprecedented way in response to the pandemic and the recession. The federal lawmakers passed several stimulus packages that included unemployment compensation expansion, direct stimulus payments, food and rental assistance, expanded tax credits for working families, and relief packages for state and local government. And that's why we're here today, is to talk more about what we can do as a state. And there's more work to be done. The other piece that I want to highlight about just this is about choices and priorities. My colleague Zach Schiller highlighted how Governor DeWine at the end of June decided to end the additional $300 a week in federal unemployment compensation benefits. That was 10 weeks before those benefits officially expired. And this hurt over 300,000 workers and their families in Ohio. But it also cost businesses close to $1 billion in spending that didn't happen because those federal dollars weren't flowing to Ohioans and their families. And while that decision was made, we're talking about the ARPA relief dollars. Governor DeWine also used nearly $1.5 billion to wipe out the U.S. debt that Ohio businesses have accumulated paying for unemployment compensation since the pandemic began. So That 1.5 billion, that's more than half of the federal funds that Ohio will get this year. So what does that mean? Basically we view it as, we cut benefits paid for by the federal government to unemployed Ohio workers, while we used other federal funds to really bail out Ohio businesses. It was a redistribution of income from unemployed Ohioans to Ohio business. And again, a lot of this was done without public input or public debate. So again, that's why we're here today, to speak up about our issues. So we're calling on our elected leaders to really prioritize people over corporate profits. And again, especially folks who have been excluded from prosperity and opportunity. So we worked with the Ohio Children's Budget Coalition to develop recommendations to really help stabilize and improve the lives of children and families. So you've already heard many priorities today, but we put forth a proposal for hazard pay for low-wage essential workers. You can go to the next slide. This slide shows how several essential workers, home health aides, nursing assistants, teachers assistants, childcare workers, these are all essential workers, and they've taken on additional risk during the pandemic. They're also among the lowest paid workers in Ohio. Each of these jobs pays below $30,000 annually. And they pay so low that a family of 3 would need food assistance just to make ends meet. So we're calling, next slide, please. We're asking Governor DeWine and state lawmakers to allocate $50 million of the ARPA funds for a grant program for frontline essential workers for hazard pay. And this would help children and families with incomes at or below 200% of the federal poverty level to make ends meet, to meet their basic household needs like childcare, food, and housing. And we're recommending specifically a program that awards $1,000 one-time payments. It could support up to 50,000 families. And again, it will provide much needed relief. As Rebecca said, providing essential workers with one-time hazard pay is an eligible use of the relief funds under the American Rescue Plan Act, and other states, including Pennsylvania and Michigan, have used federal relief dollars to provide additional funding to support frontline essential workers. So we are asking Ohio to follow their lead and really ensure that we're supporting people and supporting workers for their tireless work. Just want to say thank you for having me, and thanks to all the speakers and advocates for Ohio's future. And I think I'm the last speaker, so I'll pass it back to Kelsey.
Excellent. Thank you so much, Will. And thank you again to all of our presenters for putting together their proposals, for really thinking about the needs within the populations they serve, different ways that we can continue to make Ohio even better and continue to recover from the pandemic. It's amazing to have such a great group of folks together today to talk about, again, what's happening out there and what good we can do when we think together. Again, we were joined together today to make sure that we had an opportunity for some public input and to talk about these proposals. Unfortunately, there is no sign from the administration or the General Assembly that they will be giving the same opportunity to folks when they're continuing to make their decisions about funding, priorities, and hopefully maybe we'll change their minds. Maybe we'll see something soon. Maybe you'll see some opportunities soon. Once again, folks, this full webinar was recorded. It will be up on our website at advocatesforohio.org by this afternoon. If you have any questions or follow-ups, please feel free to contact me. Please feel free to contact our speakers. Their presentations will be available as well for download on our website. So friends, thank you so much again for your time this morning, pushing into the afternoon. We may be back soon. Again, if we hear any changes about the plans for ARP funding and priorities, any opportunities for public input, as always, keep an eye on our emails for up-to-date information, as well as our social media for different opportunities and for some information on what we're hearing at the state level. We want to thank you once again for your time this afternoon. Enjoy the rest of your day, and we'll talk soon. Have a good one, everyone.